Dear friends, every year 10th October is observed as World Mental Health Day. This year 10th October 2023 is observed as World Mental Health Day. This year the theme is Mental Health is a Universal Human Right. What do you mean by Universal Human Right? And what is the theme of this day? The purpose of the World Mental Health Day is it creates a awareness on the mental health, and people are being aware about the stigma and discrimination of the mental health. First observation of World Mental Health Day was started in the year 1992. So in subsequent years from 1993, every year a slogan has been given to create awareness on mental health among all the stakeholders, all the people, policymakers, administrators, those who are related to mental health. The theme of every year is chosen by World Federation of Mental Health to create a special focus on specific area to create awareness in the community with the involvement of all the stakeholders. This year, the theme is Mental Health is Universal Human Right. What does it mean? As you know, as per the theme, mental health is a basic human right, and mental health should be accessible and available in each corners of the country for positive well-being and protecting the basic rights of the human being with dignity. All the rights of mentally ill should be well protected by the state as mentioned in the revolutionary Mental Health Care Act, which was passed in Parliament in 2017 as Mental Health Care Act 2017. The mental health is not related to only mental illness. Many people has a wrong idea that mental health is related to mental illness and their caregivers. But in fact, mental health is not only for treatment and prevention but promotion of positive mental health well-being. That means mental health is required by all the people at all point of time throughout their life. Positive mental well-being means, what do you mean by positive mental health well-being? Why every people require it? As WHO has defined that health is a concept of physical, mental and social well-being. But still 21st century we have not given so much importance to the mental health. Everybody has felt the value of mental health during COVID-19. Positive mental well-being means feeling in control of your life and personal decision, having mental resilience to cope with challenges and stresses of everyday life. In normal daily activities, someone is able to focus on work and activities. This is promotion of positive mental health. Positive mental health is applicable to individual, to family, to community and ultimately to the society. In individual level, positive mental health being, it is promotion of positive mental health well-being, wellness, positive thinking. Positive mental health means happiness, life satisfaction, psychological well-being and social well-being. Mental resiliency, coping. In the family level, it means positive relationship. At the community level, it means interpersonal communication, community involvement, social involvement. Similarly, positive mental health means everybody have to develop a positive thinking skills, positive coping strategy, problem solving skills, setting and achieving a goal. Now we will discuss what are the epidemiology of mental illness in our country. A national mental health survey was conducted in our country by National Institute of Mental Health and Neuroscience, Bangalore on 2015-16. Survey report, the population of our country, India, is around 140 crore and the psychiatric morbidity was 10 crores. And the persons, those who are suffering from severe mental disorder is 1 crore. Considering this epidemiology, everybody should think what is the gravity of the problem. That means 1 crore population is suffering from mental illness who require active care of the mental health professional. Considering this gravity of the problem, as per the Mental Health Care Act, a new revolutionary concept has been given in our country about the right of the mentally ill. In the Mental Health Care Act, highest importance was given to the rights of the mentally ill. This is in concordance with this year's Mental Health Day theme. Mental health is a universal human right. As per the Mental Health Care Act, coinciding with the World Mental Health Day slogan, what are the rights of mentally ill? We will discuss one by one what are the rights, what are the basic rights. The first right is right to access mental health care. Right to mental health care means every person shall have the right to access mental health care from mental health establishment managed by the government. Mental health service should be available in all locations which is affordable, accessible and acceptable to persons with mental illness, their families and caregivers. All the mental health service including outpatient service, inpatient service, community-based rehabilitation, halfway homes shall be made available starting from the community to all the higher levels in all public health system. Mental health service to be integrated with general health service. All the essential psychotropic drugs should be available free of cost. And free treatment has to be provided to homeless and BPL card holders. Then, right to community living. Right to community living means every person with mental illness has the right to live in the community. The government should provide treatment in the community-based mental health establishments. Section 20, it defines right to protection from cruel and inhuman and degrading treatment. Mental ill patients should have privacy in clothing, sanitary conditions, hygienic environments and recreational activities. Mental ill patients always to be protected from all types of physical, verbal and sexual abuse. Section 21 means right to equality and non-discrimination. What do you mean by that? To provide equality and non-discrimination means to provide emergency service, adequate and appropriate living conditions equal to physical illness in all mental health establishments. Insurance facilities to be available to all mental illness patients as per the Mental Health Care Act. Then Section 22 defines right to information. Every mental ill patient has a right to get all the information where he is treated or rehabilitated. That means all the information about the mental ill patients. Similarly, right to confidentiality means every mental ill patient to write that his information, that means treatment and rehabilitation, should be made confidential by the mental ill professionals. Then Section 24 defines right to restriction on the release of information in respect of mental illness. Section 25, right to access medical record. That means every mental ill patient can access the medical records where he is treated. Section 26 defines right to personal contact and communication. A mental ill patient, wherever he or she may be, she can contact his or her family members at any point of time. Section 27 defines right to legal aid. Every mental ill person has the right to avail the legal aid by a lawyer who has sufficient knowledge on the mental health. Similarly, Section 28 defines right to make complaints. Anybody can, any mental ill patients or his nominatory representative can give complaint against any mental health establishment or any mental health professional. Friends, the most important point in our country is mental health is a universal right, and as you know, in our country, National Human Rights Commission plays a very great role for protection of the human right. National Human Rights Commission has the capacity in that inspect all mental health hospitals in the country, report the deficiencies to the appropriate authority, recommend the remedial measures for correction and protect the basic rights at all levels. Dear friends, why mental health is important? Nowadays, as you know, the mental health is becoming complicated because of the substance abuse problem in our country. It is so grievous, as you know, a survey was done in 2019 by All India Institute of Medical Science, New Delhi, where it has been found that around 5.7 crore people in our country are alcohol dependents. 72 lakhs people are cannabis dependents. 77 lakhs people are opioid dependents. And 22 lakh are inhalant dependents. From this, you can know how much of people are addicted to the substance, or how much of people in our country is consuming the substance. So, after consumption of substance, every individual become addicted. So, at a point of time, they require intervention of the mental health professionals. Similarly, like substance addiction, in country, another problem is suicide. Suicide, the student suicide has just increased just like in anything. As you know, because of the pressure or academic pressure or any issue, the student suicide is increasing day by day. A survey was done in 2021 where it was found that around 8% students among all the professionals are committing suicide. Our students, our youths are our futures. And students, because of academic pressure, nowadays it has become a very alarming problem. As you have listened from our media, or as you have felt that in Kota, many students for their professional coaching are under pressure and they are committing suicide. If you consider suicide, there are around 1,64,033 complete suicide done in India in 2022 as per the National Crime Record Bureau. That means 449 complete suicide per day and 12 reported suicides per 1 lakh population. Just imagine what is the gravity of the problem. And for your information, for one complete suicide, there are 20 times there is incomplete suicide. That means when there is 1.64 lakh 33 suicide, there are around 32 lakhs incomplete suicide. Everywhere in our country, as per the data in 2021, 12 out of every 1 lakh people in India died by suicide. And if we go to the gender issue, in what a survey done in Delhi, it was found male are at higher risk than females every time from 2018 to 2021. So the suicide rate is around 12 per 1 lakh population as per 2021, and in the country everywhere it is increasing day by day. So it is a issue, it is associated with mental health issue, we have to take it seriously. Similarly, after mental health, somebody affected by mental disability. In the mental illness, when somebody affected with mental disability, nowadays in our country, after someone become affected with mental illness, if he fulfills the criteria, if his or her disability is more than 40%, he is able to get disability benefits. So, following mental illness, the mental disability burden is so high. In the Mental Health Care Act 2017, first time it has been introduced, if any person suffers from mental disability following substance addiction also, he will be eligible to get mental disability certificate and mental disability benefits. And as per the Right of Persons with Disability Act 2016, everybody is getting mental disability benefits. So, what is the duty at this point of time? The duty of all in our country, everybody has a role. What we should fulfill? How the rights of the mentally fulfilled? What is the basic rights? That means, if you will consider the human right issue, that means if mental health is universal human right, what step we should take? A affordable, that means legal aid should be available to the all mentally. Mental disability pension should be available to the mentally. A comprehensive community mental health care should be available. Integration of mental health with physical health at the community level should be there. Caregiver pensions for patients of family members, those who are suffering from chronic mental illness. Similarly, one important concept which is evolving from our country, that is yoga and meditation for positive mental health well-being. Mental well-being programs in the schools and colleges, that means youth should be aware about the mental health. Introduction of the mental health in every college school curriculum, which will improve the mental well-being. So, lastly, in conclusion, I will tell, as our country has implemented Mental Health Care Act 2017, so implementation of Mental Health Care Act 2017 by protecting the rights of the mentally and positive mental health well-being for every citizen of the country with affordable cost, and it should be accessible to all. To give respect to our Mental Health Care Act and to give respect to this year's theme, mental health is a universal human right. We should treat all mental ill patients with right spirit, and we should protect all human beings with promotion of mental well-being, so that mental health will be a positive sign, it will be equivalent to the physical health, and everybody will be protected as far as health is concerned. Thank you.